So I guess we'll go ahead and get started, and then people can trickle in. I don't know about you, Jen, but I don't mind people interrupting with questions. So if you have questions, feel free to throw them into the chat and I'll make sure we address them all. Actually, last time I feel like I got a little sidetracked during the presentation. So if you want to throw all the questions in the chat, if I can address them, I will. If not, I'll make sure I get everyone at the end. So feel free to write your questions in. And thank you so much, Jen, for joining me today. I apologize, I don't have a bio for you at all, so I guess we'll just introduce ourselves.
Yeah.
Do you want to go first?
Sure. So my name is Jen. I'm a physical therapist at ECHN at Evergreen Walk. I've been a physical therapist for almost 2 years now, working primarily, again, in that outpatient setting, working with a whole variety of populations. So,
Cool.
yeah, that's a little about me.
Awesome, thanks. And for those, I mean, everyone caught part one of our osteoporosis lecture. I'm a naturopathic physician and I practice in Manchester. I've been doing so for quite some time, probably 15 years or so now. And I work alongside primary care, so essentially really promoting integrative medicine, functional medicine. So helping your body help itself with looking at biochemistry, and we're going to dive into that today. Excited to talk to you guys more about what else you can do for your bones beyond medication, because I know we talked about that a lot last time. We're going to do a little recap on some of the comments, some of the things around bone density, but really we're going to do a lot of new stuff. So if you had questions from the last time, maybe I can answer them for you. Dr. Kage was really thorough with the medication piece of things, but we're going to do a lot of new this time as well. And in disclaimers, Jen and I are not giving medical advice. We are here for educating you, but this isn't a substitute of having a physician or a PT work with you one-on-one. And we have no disclaimers to give you as far as disclosures. No one's paying us. We just like teaching people about their bodies. So essentially what we're going to be diving into is understanding bone density and really understanding the process of how bones remodel and what is happening in the rest of our body that sends messages to our osteoclasts and our osteoblasts, and understanding how to support stimulating bone growth and mitigating bone loss. So looking at normal bone, again, to recap from last time, we have cortical and trabecular bone, both of which respond to a lot of different factors in our body and are incredibly important to aging gracefully, because we want to avoid fractures. We want to feel strong, and we can get fractures both in our spine and our hips that can really be detrimental when we're older. So that's something we want to be proactive with at a younger age. And even if you are a little older and you've been diagnosed with osteoporosis, we're going to talk about a lot of things you can do to halt the loss. Another cute pictures just to kind of give you the visual. I thought I put a picture of osteoclast and osteoblast, but essentially you're always building up and breaking down bone. This is always turning over. And it's really about the balance of your osteoclasts and your osteoblasts, the breakdown and the buildup, and because it really lets us know, are we building up, are we breaking down? Essentially, we're all over time are going to break down, but you want that balance of catabolic and anabolic so that you're slowly breaking down. And there's a lot of ways we can help kind of reduce the breakdown, so to speak, and make sure we're still building up. So while we do build like 80% of our bone mass in our younger years, there are a lot of things that play a role in that: nutrition, activity level, health issues, medications. You want to work on building it up. There's also that you can maintain it over time, and you'll notice eventually there's a drop off a little more aggressively, typically for women after menopause. And so we really want to work on building up our bone mass as much as possible, and then keeping that peak up there and flatlining as much as possible as well. So what we didn't get into last time as much, and so everyone wants to know, well, what pills do I take for bone density? And that's like asking a naturopath, what supplement do I take for high cholesterol? From my perspective, there are many reasons why people have high cholesterol. There are many reasons why people have bone density issues, and there is no one size fits all. So in naturopathic medicine, we look at every aspect of a whole person. And some of these are the categories we're going to do a deep dive into tonight when it comes to bone density. but these are really important for developing basically creating strong bones and maintaining strong bones, all of these different aspects. And so some people, yes, they may genetically be predisposed to bone density issues because they're going to go through menopause early and they have a smaller frame, but there may be other things we can do to make sure that they have the strongest bones possible. And there are a lot of things that support our systems to make sure we're being proactive in this way. So really, I don't have a protocol for bone density. I have a lot of things we look at, and we're going to talk about those today. The first one we're going to really dive into, thanks to Jen, is how important our structure and our form is. So I'll let Jen kind of take over from here as far as how physical therapy can be beneficial and movement can be beneficial when it comes to bone health.
So again, physical therapy is awesome. We love PT. I love it. I work in it, so I'm a little biased. But so how physical therapy can help is that we can help with pain management. So say you're having knee pain, right? And it's preventing you from walking. You can come see us. We can work on some pain management, but also do some exercises to promote the osteoclast and osteoblast and slow down that like decline of your bone density. Part two is education, right? So we can educate you guys on how progressive resistance training can help you, about osteoporosis, if you're premenopausal or postmenopausal, the exercise intensity, frequency, and then things about like posture and more just about the whole you as a person, and then how exercise can help. We also work with progressive resistance training. Again, we load you like appropriately. We're not going to just be like, here's 50 pounds, lift it, right? We're going to work up to a point where we start with just body weight. Maybe we need to work back a little bit, strengthen a few things, and then go back to that, but focus on that body weight part of it. We also know with like decreased bone loss, that can increase your risk of falling. And when you fall, you have a fracture. And the last thing we want is for you to end up in a hospital. So we really want to work on some decreasing your fall risk, working on some balance, strengthening, and a whole mix of everything. When you have osteoporosis and you have, say, a fracture in your spine, or you're nervous about it, right? We can teach you how to do things like log rolling to protect your spine, bending down to pick things up off the floor. What's the best way to protect your spine and strengthen your core to be able to do everything that you normally do, and overall just improve your function. So part two, the benefits of exercise on bone density. So we know that exercise and weight-bearing exercises promotes osteoclast and osteoblast activity. So specifically weight-bearing, because if you're not putting weight through your bones, right, then we're not providing enough stimulus to create this change in osteoblast and osteoclast activity. We also now know that with exercise and we can help with much strengthening your muscles and increasing your muscle mass. And so there's something called sarcopenia, which is progressive loss of muscle mass and function, which is highly correlated with osteoporosis. And so we know that if you have decreased muscle mass, right, you're weaker, you have weak bones, and say you just accidentally trip on your toes, and next thing you know, you're falling because you can't catch yourself, right? That's that fracture part. So we want to make sure that you're strong enough and that your bones are healthy. So that's kind of our role in PT, to get you functioning better and decrease your risk of falls and get you moving.
Absolutely. I routinely, I would say almost every patient I have that gets the diagnosis of osteopenia or osteoporosis, I send to PT, because you want to learn how to do weight-bearing exercise right, and you want to prevent injury, because that's going to set you back even more with weight-bearing exercise, and it like is such a key piece of things. You know, in modern society, we can sit all day long and not even realize we didn't get a lot of exercise, and we get really deconditioned, and all of a sudden, you know, engaging with our bodies and just jumping into weight-bearing exercise can lead to an injury. And so it's lovely to have you guys on board, like they're coaching you, getting you on board with a plan. It's really a wonderful resource. And insurance is happy to invest in this because we want to prevent sarcopenia. We want to prevent osteoporosis from progressing for sure. The crass term for a sarcopenia, which is interesting, is they call it skinny fat, because a lot of people who have a normal BMI, right, may end up actually losing muscle and having more body fat, and that is still going to be dangerous. Like you can be a healthy body composition from the outside, like a healthy like weight and BMI, so your primary care, the guy, you're fine. But if you're losing muscle, that's going to put you at risk for bone density issues and a myriad of other conditions beyond just bone density, memory being one of them as well. So muscle mass is definitely a key thing, and doing it in a safe way, working with a PT is a great way. So thank you so much, Jen.
So I saw that someone said, what is sarcopenia defined? So sarcopenia is a progressive loss of muscle mass. And so it happens as we age. And so it just gets worse as we get older, around that, like, I think 60 to 80s when it really gets worse. So that's when we really want to focus on that strengthening and progressive resistance strengthening as well. Did that answer your question?
You know, it's one of those things where like we're in our 20s and even 30s, like a lot of us are active, but we don't like have as much intention around exercise. And then as you start to age a bit, you're like, oh no, this is something I'm just gonna have to do, because otherwise I'm gonna lose my muscle. Our body at some point doesn't make it as much of a priority to make muscle. And so they call it sarcopenic obesity. When you actually are slender, you have more body fat and you're losing muscle, you can still be considered like a sarcopenic obese. So you can get actually your muscle mass tested, and that's something that you can monitor. So if you're working with a PT, you can make sure you're building muscle and losing body fat. And I swear, we were joking, Chantel, that like my dogs know when I'm doing a lecture. Sorry guys. At this point, I feel like everyone who's done a lecture with me knows like one of the Noah's Ark out here is going to show up on my lap. So yeah. So that's a great question though. And a great focus is to make sure you're just feeling stronger in your body as a goal. And that definitely is going to translate to bone density and muscle mass. So I was pulling more research because I was like, oh, a part 2 of bone density. And granted, I didn't get to go into a ton last time. So I wanted to find some interesting stuff for you guys. One was water. So we are, as a culture, very dehydrated. Soda and coffee and alcohol do not count as hydration. And so a lot of us are walking around dehydrated. We're those poor plants that have just gotten used to the soil being dry. And interestingly enough, as we age, the thirst mechanism decreases. And so it's common to be chronically dehydrated and not get the cue of thirst. Thirst is one of the last cues of dehydration. And so water can play a huge role when it comes to bone health. And this is all fun stuff I looked up for you guys. So these are lots of different ways bone can help with, water can help with bone health. Bone is actually 30% water. And there's a lot of different ways. Check out this picture I found for you guys. There's a lot of different ways that water can interact with our bones. It actually makes up part of the structure. It can help bring a lot of nutrients to the area. This is one study looking at bone hydration as a new targeted measurement for bone health. And they were finding like this is all the different ways water basically functionally builds into your bone system. So there's 4 different ways. And if you look at some of them, they're actually making structural water molecules building part of the carbonate and the lattice work of your bones together. So hydration is incredibly important. And the other ways that I see that this really being beneficial is it's also water hydration allows your cells to freely exchange ions like magnesium and calcium, which we know are incredibly important. And also water is key to using one of our major detox organs, especially our kidneys. So our kidneys clear a lot of toxins that can potentially be a risk of issues with bone density, which we'll get into in a bit. And so hydration alone helps clear a lot of these toxins that could be a potential risk for our bone density. So the other thing is water's free. It's easy. It feels like a chore at first, but hydrating can be a tremendously supportive things for your bones. And if you're one of those people who's like, oh, I never get thirsty, start making yourself drink water and you might make your bones stronger. So I thought that was really interesting research to find for you guys. A recap of last time, because I can't not talk about diet when it comes to bone density. It's just like in my blood, right, as a naturopath. There are a lot of, to recap, there's a lot of research out there on diets. And I think it's kind of like You guys remember the first Batman movie where it was Michael Keaton and the Joker poisoned everybody? I don't know if you guys are all comic book nerds like me, but here we are. The Joker poisons everybody by like hairspray plus lipstick equals turning other people into the Joker. Yeah. And so it's not one hit to your bones, it's all these little microaggressions to your bones, the lack of movement, your diet having a lot of processed food, you know, being dehydrated, genetically having things, stress, we'll get into all these things, all these little microaggressions affect your bones. And so we have to kind of look at every little aspect of it. So it's hard to study diet for lots of reasons, but one of them is it's just looking at this one thing. So literally they've looked at all of these diets I listed, high protein, low protein, all of these things have been shown to be a risk for bone density, which doesn't make sense because some of them are contraindicating each other. It's when you're looking at that one little aspect of diet, it's hard to look at a big picture. Essentially, based off some meta-analysis, a whole foods diet, less processed food, which is a no duh, but it is nice to have it as a reminder that vegetables, clean protein are kind of the way to go when it comes to supporting your bones and like a million other properties in your body that love vegetables and a good amount of protein. I pulled this from John Hopkins has some great research on how much protein someone should be getting. It's a lot more than you realize. And so just an idea would be, this is from their website, that, you know, for a 140-pound woman, you're looking at about 60 grams a day. That's a lot more than you realize. So just protein should be like the on your plate when you look at it at dinner time. Where's my protein? Where are my vegetables? Actually pretty much every meal you should be looking at for that. So again, that's a little bit of a recap. One thing to dive down into though is that our diets, even being in a whole foods diet, may have less nutrients than our grandparents even. And there's a lot of reasons for that. Practices with farming, they're using the same soil for the same vegetables over and over again. And so what happens is if it's a carrot and the carrot farmer keeps doing their thing, the carrots are going to pull from the soil what they need. And then over time, they're going to have less nutrients in those soil. Additionally, we have a lot of cool tricks where we can like plump up a carrot without a lot of nutrients anymore. It's a tomato during the winter versus a tomato that's local in like August or September. Very different creature, right? So that's kind of the problem with some of the nutrients in our soil. And we're finding, and there's some really disturbing research on it, that there's just a lot less calcium in our food. There's a lot less overall nutrients. And I won't read the whole study to you guys, but essentially across a couple different studies, and I list them all here for you, there's just substantially less nutrients, and calcium being one of the major ones. Interestingly enough, this is because magnesium wasn't like found as a nutrient until a little bit later. So a lot of the research isn't on magnesium, although I would say magnesium is as important for calcium, if not more. So I'm sure magnesium levels have been declining a lot of these nutrients too. So that combined with, if we look at the rest of these issues, malabsorption of nutrients, we're going to get into that, increased demand for nutrients because of medications, all of these things, and highly processed foods, we have less nutrients in our diets, which is something why we kind of look at vitamins and minerals, which we'll get to. We'll do a little deeper dive into some of the impacts of medications, and I'm not anti-medication by any means. I think medications save lives every day. I think that they are appropriate in many cases, and sometimes even for chronic conditions, but we need to be mindful that there is such a thing as medication-induced nutrient depletion. And so what that means is that by taking a medication, you may need more of a nutrient to help that medication work or get detoxed. And you may not absorb nutrients as well because of being on a medication. So these are things we want to be mindful of, just like drugs have interactions, drugs and nutrients have interactions, and it's something to be aware of, so that if you know you're on, for example, an oral contraceptive, an incredibly common medication, there are going to be increased demands for certain nutrients, and that's going to translate to your unique biochemistry and how we support it in your bones. So this is from a heavier lecture of mine that has a lot of sciencey words in it, and I'm happy to triage all these words for you. But I thought it was a great like synopsis of what we talked about more last time. Like, so essentially, in my mind, there are a lot of nutrients that play an important role for bone density. Calcium gets a lot of street cred, but I think honestly, magnesium and vitamin D should be looked at as much, if not more. There's correlations between bone density issues and homocysteine, which is a blood marker that is a sign of how your body is detoxing, and specifically is a reflection of some nutrients, B6, riboflavin, and B12. And so, you know, most labs have this, ECHN does, Quest does. If you code it right, it usually gets covered, and that will give us an idea of like, if your homocysteine's high, then we have to make sure we're addressing that too. A cardiologist routinely look at homocysteine, and I know rheumatologists do as well. So it's something to be mindful of that doesn't get talked about the same way as calcium. K2. So just a recap with K1 versus K2. K1 is found in leafy green vegetables. It is the antidote to a blood thinner called warfarin, which is like an older blood thinner that's not used as much because it's harder to control, but it is not the same as K2, which is created by the bacteria in our GI tracts. And it can also be found to a lesser extent in certain foods like Gouda cheese. Most of us aren't eating Gouda cheese on like a daily basis. So K2 is probably one of my favorite things to consider when it comes to bone density, because it upregulates the production of taking in calcium into the blood vessels. And so it downregulates calcium and keeps it out of the blood vessels and upregulates it into bone tissue. And so K2, again, not typically found a lot in the diet. I don't find it typically impacts blood thinning it much at all, but it's definitely something to put on your doctor's radar before you would start something like this. You know, one of my kids gets cavities like a champ genetically, and I have him on some K2, and I swear it's calmed it down. And if you think about it, your teeth are like little bones sticking out, right? So it's a sign of your bone health. So K2 is a wonderful nutrient to help support bone growth. I kind of spell out the mechanisms of a lot of these nutrients. The take-home message is that like you have a lot of trace minerals, boron, copper, iron, which is a really common deficiency in this country, manganese. These all play a role in bone formation and really are important. Minerals can be toxic, so it's one of those things that you want to kind of have a conversation with your doctor. Is this something I'm getting much in my diet? And is this something I can test in my blood? All of these are testable through a conventional blood test. And then kind of tailor what your nutrient needs are based off of your diet, your medications, those type of things as well. With iron, again, I kind of like outline how it works. It's going to impact, oh, I'm so sorry. It's going to impact osteoclast. It's also going to impact how vitamin D works. I like to look at a test called ferritin, which is your iron stores. It's not just the iron circulating in your blood. So if you think about it, iron that's circulating through your blood is kind of like what you have in your grocery cart that you're bringing into your home. Ferritin is like your pantry that's at home already and what you have in the stores. And what we found is ferritin levels reflect a lot more about like how your body will allocate iron to different processes and how it'll use it. So my favorite resource about iron, if you feel like nerding out about it, like I like to, would be to go to Harvard nutrition program, has wonderful research on it. And I highly recommend researching, looking into having your ferritin levels tested to make sure that you have adequate iron stores as well as iron circulating in your grocery cart. Selenium is lesser talked about as well. Selenium can be toxic in high amounts as a antioxidant. It's wonderful, but I mean, I'll be honest, in how many years ever seen selenium toxicity, but in theory, don't just take loads of this without talking to your doctor, but it's amazing for immune support, for bone density. It's a great antioxidant. It's found naturally in like the best form of selenium there is in Brazil nuts and almonds. And so if you're eating them raw, you need 2 Brazil nuts a day to get your daily dose of selenium. So I highly recommend, if you can eat raw nuts, then I would say Brazil nuts and almonds are a great source. 14 almonds, 2 Brazil nuts. Also found a lot in nuts and seeds is zinc. Zinc has, we did a deep dive on zinc last time, but I just did a little recap on a lot of these things. The other thing we're going to do a little more on with zinc when it comes to it this time is it also helps with detox. But it again upregulates production of both collagen and bone production, and inhibits the bone resorption as well. Strontium. We didn't talk about strontium last time, and I wanted to kind of touch base on it. So strontium has been studied as a medication. So I'll back up. You guys remember from chemistry class in high school, the periodic table of elements, and there's all the little ones. And so calcium's on there, and that same row column below it is strontium. Strontium is a mineral, very similar in a lot of ways to calcium as far as how it works in chemical pathways. However, it's denser and stronger. And so with that thought process, we've thought, okay, well, if it's a denser version of calcium, it'll make your bones denser. And so this medication has been studied to help with preventing and treating osteoporosis in Europe. It is not the medication that is available in the United States. I almost said Connecticut. I just did, but it's not available in Connecticut either. What is over the counter and in many supplements is strontium citrate, which is not this medication. But what's interesting about strontium is they found places in the world where there's a lot of strontium in the soil. And so therefore a lot of strontium in the food sources. And then therefore people have more strontium in them. And in those locations where all those things are happening, there are less fractures. So there is a lot of interest in strontium. Strontium citrate proper, the one that we have on the shelves as supplements, is not this medication. And it does, there are like clinical reports of it improving bone density. It definitely increases the density. Whether or not strontium citrate prevents fractures remains to be seen. A lot of this is like, there's a lot of correlations there and less direct research on strontium citrate. The thing to know about strontium is that it competes with calcium. It's going to compete with calcium for absorption. It's going to compete for calcium for getting into your bones. And it's theoretically said that you should disclose that you're taking strontium to your doctor, because it may look, your bone density may look falsely more dense. So my big thing with it is I don't like it when it's in a formula with calcium. It's safe. I don't see any issues with it, to my knowledge. There aren't any negative side effects that I've seen with it, other than my concern that it competes with absorption. So I'm not a big fan of strontium calcium combos. If you're going to do strontium, it needs to be away from food. There are some case reports of like it upsetting someone's GI tract would be the biggest thing I've seen, which sometimes can happen with calcium too. So when we're referencing it, it's not this strontium that's in the study. That sounds very cool. We don't have this medication. That's the FDA, and I'm not sure why, but just so you guys can speak to calcium and kind of understand it. So if you are talking about it, talk about it with your naturopath or your primary care doctor, whoever is working with you for your bone density, and just kind of be mindful that it's it's a potential supplement you could take, but there are some thoughts that you want to have around it. I thought these were cool studies. Basically that bone turnover, I think, is related to inflammation, but they've shown that basically taking omega-3 essential fatty acids can help downregulate bone turnover in a way that benefits fortifying bone. And so without getting into the whole fatty acid pathways, essentially there are fats in our body that we utilize that we can't make ourselves. We can make a lot of our own stuff. That's a pretty cool thing about humans, but we can't make any of the omegas, omega-3, 6, or 9. They all have different roles in our body. omega-3 is incredibly good at calming down inflammation, which is a very common term in our society. And so what we found is there are some links between inflammation and bone density, like basically down regulating bone formation, up regulating resorption. And so just taking out that inflammation is my theory. Otherwise, just taking fish oil, they found, has improved bone density, which is kind of cool. Another cool study I wanted to share with you is, people know, and most doctors will warn you, long-term steroid use will lead to issues with bone density for lots of reasons we can talk about. It messes up your whole hormone pathways and throws off your blood sugar, and is life-saving and extremely important for you to be on a steroid if you need to be on one, but it can impact your bone density too, especially if you have to be on it more long-term. This is a cool study looking at a very safe bioflavonoid. So bioflavonoids, think of them as like natural vitamin C's in our body, and they're typically found in fruits and vegetables. This is, I Googled lutein, and the first image that came up was an artichoke for you guys. So I'm assuming it's high in, I don't know that artichokes are high in, it's a luteolin, actually. It's a variation of lutein. There's a ton of these like bioflavonoids, and they basically are nutrients that fortify our body and reduce inflammation by reducing oxidative stress. So I thought this was really a great little like study looking at like, okay, if we reduce oxidative stress and we kind of protect the osteoblasts, then we can actually buffer the effects of steroids. If yes, you have to be on a steroid to calm down your autoimmune disease or whatever else is going on in your body, that's important, but maybe there's some things we can do to kind of mitigate the bad effects of that steroid. Bioflavonoids are very safe. They don't interact with medications very often. So this would be a great thing to consider if you have to be on a medication like that. And then just a little on my soapbox. I hear this treatment plan all the time. This is, go on calcium and vitamin D. And right, and so Oscal is a common one. I'm not knocking them again, but like, look at the ingredient list, guys. Like polysorbate 80 has been shown in cause like IBD and like autoimmune conditions in GI tracts, and is a filler, but it also is like there's just a lot of junk in these supplements. Supplements are not regulated by the government. You can put anything in a capsule and say whatever you want about it and sell it, and there is no repercussions to that. And so it really, when it comes to nutrients that you're trying to hit a therapeutic dose, when we just got to be really mindful of what's in here. A simple way to look at this and know that it's not great: there's corn syrup solids and dye in it, so, and methylparabens, which are preservatives and fillers. We don't need any of that stuff in there. So when you look at the bottle, check the ingredients for stuff like this. Also, you can make sure it's GMP certified, or general manufacturing practices certified. That's going to ensure that there's it's basically the industry is self-regulating, and so they're making sure they have those practices similar to that of a pharmaceutical. So they have to test the raw ingredients before it goes into capsules. They have to test the capsules to make sure they have what they say they're having in them, and then they have to put an expiration date on them, and then the expiration date typically is 2 to 3 years. They have to hold on to the bottles, and they got to make sure in 2 to 3 years it still has, like right before the expiration date, it still has what it said it's supposed to have in it, because we have to make sure it's actually what it needs to be. So GMP is a way to make sure you're getting a good quality one, because you're trying to do something good for yourself. Taking pills every day is tough enough, right? Make sure that they're quality ones. But what's the point of taking pills if your GI tract can absorb them? So there are so many conditions. I mean, essentially we're human walking tubes, right? And so we are absorbing the stuff that goes into our GI tract, but our GI tracts get a lot of insults from the environment, from stress, and there are a lot of things that compromise our GI tract, and that will inhibit the absorption of these nutrients and minerals, which can very much impact our bone density. So we know that proton pump inhibitors are very important at points for helping with acid reflux, stomach ulcers, gastroenteritis. However, they definitely put you more at risk for not absorbing your nutrients, and then that is going to translate to an issue if you're not getting enough nutrients for your bones. Another really interesting study, H. pylori, is a bacteria that can lower your stomach acid and then therefore compromise your ability to absorb nutrients. And they found that that correlated with bone density issues, which is, something to be mindful of. So H. pylori can cause inflammation. It's typically treated either with herbs or with antibiotics, and it kind of knocks it out. The main symptom of H. pylori is typically acid reflux. Again, a sign of like if your GI tract is not happy, neither is your naturopath. We need to make sure your GI tract is healthy, because that is how we're getting all this good stuff into you. And so if it's off in any way, acid reflux, IBS, anything going on GI wise, we need to make sure we're addressing that to get all the nutrients that you're going to put in, whether it's vitamins or food. I referenced this one, and I think there's a lot of celiac patients, and so I pulled one of the studies. I think there's a couple of them, but essentially, this is one of the studies basically showing that, like, if you have issues with celiac disease or any kind of absorption abilities, so if like you're with celiac disease, the autoimmune condition associated with gluten, and so essentially gluten creates an autoimmune reaction in your GI tract, and the little cilia, you have like these little hairs in your GI tract that are meant to absorb nutrients. They get like cleaved and beat up. So this is like this is what my hand like right now is what your GI tract looks like when they go in and look at a celiac GI tract. But honestly, a lot of other GI tracts look like this too. They look all beat up because of IBD, IBS, other irritations. Sometimes medications affect it. And if you can't absorb your nutrients, regardless, then it's going to impact your ability to absorb vitamin D in this case, or other nutrients. So the take-home message is that when gut health is incredibly important and a focus for bone density, because it is so incredibly important to get your nutrients in through your body. Also, you have 75% of your immune system wrapped around your GI tract, and a better part of our microbiome are our probiotics and our bacteria, and actually fungi and parasites and viruses that live in us, which are some of more bacteria and a little bit of viruses and fungi than anything. But all of that microbiome really impacts our ability to absorb nutrients as well. So the GI tract needs to be healthy in order for us to have healthy bones, and those are very directly connected. So are stress and hormones. So this is a hefty slide. I am not going to read this to you. I figured this was a way for me to streamline a tremendous amount of information to you and speak to you about, okay, here are the main hormones in our body, from thyroid to stress hormones, sex hormones, the hormones that are responsible for calcium, hormones that are responsible for growth, and also interacting with leptin has to do with our adipose tissue and our body fat. So those all impact directly our bone production and absorption directly. So if we have too much cortisol, we are going to reduce our absorption of calcium in our GI tract and stop production. Our body's in stress mode, it's in preserve mode, it doesn't want to worry about bones, it wants to deal with the stress. If our hormones are off, that is also going to happen. So this is incredibly important to address as well. Just like we need to be able to address our nutrients. If we're getting all these nutrients in, we're doing all this great stuff, and then our sleep is off and our hormones are off, this is going to throw us off dramatically. So this is why it's important to make sure we're addressing thyroid issues and stress hormones. And this is where functional medicine shines as well. Oh, here's what, because there are conditions with your cortisol levels where you either have too much cortisol, Cushing's disease, or not enough cortisol, Addison's disease, and you need to be on medication one direction or another. And then there are functional levels, which is like you're not diseased, so we're not gonna, but there's dysfunction with the biochemical pathways, there's dysfunction in your response to stress. And that's where we want to work and look at these things so that we make sure we get you in a balanced way long before it becomes it's never necessarily going to go into a dysfunction with that level of needing medication for your stress hormones. but it could affect your mood. It could affect your bone density. It could affect your GI response. And so this is where we want to look at all these things proactively. So when it comes to balancing hormones, there's a lot of different approaches and thoughts behind it. And so that maybe we'll do that as a lecture next, part 3 of our bone density lectures. No, I'm just kidding. I get oh, Jen, go ahead.
A little caveat too, right? Like
Yeah.
exercise which help relieve some stress. And so there's like another great way to naturally relieve some stress by going on a walk, exercising. So I always say when you exercise, release some happy hormones, right? Help
For
some
sure.
levels and work on some like deep breathing. So again, calm those down. So another, you want to do some physical therapy.
I love it. I love it. And I really think like making sure you check with someone to like make sure your body's in a place to like, got deconditioned through COVID and a couple babies. And like, I feel like working with a PT to make sure I was like, my core was good before I went off to the races again, literally. So is such a key thing.
Absolutely.
So yeah, your cortisol, which I thought was on this slide and it wasn't. So we can test these hormones all different sorts of ways. Your cortisol is supposed to be high in the morning and then over the day slowly goes down and calm at night, and then you get to go to fall asleep, right? And so exercising in the morning especially is a great way to burn off some cortisol. And so cortisol aside, there's also all your other hormones. Estrogen, we saw on that last slide, I mean, is magic for your bones, right? Which is why we don't really talk about bone density as much in men. And we also don't talk about it with women until they hit menopause. And it's like, oh, we might want to screen them now because our estrogen quiets down. We still make some, we make less, and it doesn't come from our ovaries anymore. Those girls go out to pasture. And our stress hormones come from our adrenal gland. And after menopause, our sex hormones come from there too. And so your adrenal gland has double duty after menopause. What happens is your adrenals make a precursor to estrogen, and then this precursor circulates through your body and becomes estrogen. And that's where we get our 25% of our estrogen before menopause, and 100% afterward. And so estrogen is incredibly important for bone density. So if you had a really early menopause, if you had a hysterectomy with a double oophorectomy, the ovaries had to be taken as well, you're at risk for bone density issues. If you had to be on medication that suppressed estrogen because of cancer or any other health condition you had going on, that also could put you at risk for bone density. And so we want to be mindful of how to address that. And so some people will be like, all right, and again, this could be a whole other topic, but there's lots of different ways to look at it. And there's a lot of tools. And so that's my message in this, is that typically for hormones, there's not a lot circulating in blood for when it comes to sex hormones. We want to look at those in either dried urine or saliva. ECHN is super cool, and they've contracted with the salivary hormone testing lab. And so most of that testing is covered by insurance, including Medicaid and Medicare, which is amazing. And so you can look at the testing there, basically looking at all the different types of estrogen, testosterone, progesterone, and even the precursors to your other hormones to make sure we're supporting everything really well. I'm not a huge fan of hormone replacement therapy. So when we talk about hormones, basically most HRT therapies have a risk of cancer associated with them. They're synthetic hormones that basically mimic our estradiol, the strongest estrogen in our body. And while it will be really helpful for bone density, there might be other ways we could look at that. My preference would be to use BHRT or bioidentical hormones. These are usually done in smaller amounts and more mimic our body's production of things. And they usually do, like, for example, they'll do like the upstream precursors of estrogen, like DHEA with a little bit of pregnenolone, another precursor, and then a little bit of estriol or estrione, like a different type of estrogen, or a balance of all 3 estrogens. And usually what's happened when you see a practitioner who does this kind of work, I do not, but I refer a lot out, and some of the doctors in my office do it. They'll compound it and they'll make a combination based off of your testing that matches what our goals are for your hormones. So I like that for lots of reasons, because it's not pushing you over the edge. It's letting your body make decisions on how much it wants to make, but it's giving it all the tools to create a lot of balance. And again, we know that balanced hormones equal happy bones. There's also plant-based hormones. soy is the one that gets the most attention, right? So there was a lot of studies a few years ago on, well, probably more than a few years ago now, on bone density or hot flashes in soy, drink soy milk for that kind of stuff. There actually is a decent amount of research behind that, and it's the one, I think it's the next one. So genistein is found in soy, but it's also can be found in non-soy derived hormones. They basically genistein is like the phyto-based estrogen that can help with bone density. So it's in soy, but there's two prescription. Well, there's a prescription and there's an over-the-counter supplement. I'm not prescribing this for everybody, but I would just say like it's something to talk about with your doctors. It's a medical food that's a prescription, Fostium, or there's a supplement called Osteobend. And these are non-soy derived genistein that basically works similar to an estrogen. So it's not safe with any kind of estrogen positive cancers, but it's been shown to be really effective with bone density. So one of the closest, the either an endocrinologist or rheumatologist, or actually UConn has a great bone osteoporosis clinic, and they use a lot of Fostium and genistein, which is interesting. So it's a supplement. It's more natural minded, right? It's helping the body help itself, and it's using plant derived phytoestrogens, which, to give you an idea, we're looking back on these estrogens, right? There's E2, the strongest one. That's the one that's HRT derived, like to mimic E2. E2 is the more cancer promoting of the estrogens. It's the big, loud older sister. And then E1 and E2, E1 and E3 are very like 100 times or 1,000 times weaker than estrogen E2. And so most of the cells in our body, including our bones, have receptors to estrogen. And if an E2 hooks up to that estrogen molecule, to that estrogen receptor, it's going to make things happen. Like, right, E2 makes it happen. It's loud and in charge. If E3, for example, attaches, it's really not going to stimulate that much. It'd be a little bit, but it's not really going to push it too aggressively. And so it'll be an estrogen, but it's not a loud, aggressive estrogen. And actually, there's a lot of research showing the balance of these estrogens can be a preventative for breast cancer, or can be associated with prevention of breast cancer. So when we're talking about plant-derived estrogens in the context of either soy or genistein that's not soy-derived, it's like 1,000 times weaker than E2. And so if it stimulates that estrogen receptor, it's not going to be gangbusters, like growing like crazy or anything like that. It's going to be a weak nudge in the right direction, but it's not going to be anything crazy. So it has been shown to help with bone density. There's a lot of meta-analysis when it comes to soy, and one of my associates did a great write-up on it on my website, and basically showed like soy has no correlations with breast cancer, is not contraindicated, even if it's an estrogen positive breast cancer. So as a side note, I'm getting derailed, but my point is that soy and genistein would be something to talk about with your doctor, because it can be really helpful for women after menopause. So the other thing that's really interesting that we didn't talk about at all last time is detox. So we live in a toxic world. Plastics, all that stuff right there from our food, all this other stuff we get exposed to. We can't help but not be exposed to it. We have 4 ways to get stuff out of our body: urination, perspiration, defecation, respiration. Breathing, deep breathing, as Jen mentioned. Sweating, which happens with exercise, but also sauna. Yep. Kidneys and colon. That's how you get stuff out. And so if you're not hydrating, if you're not having regular bowel movements, if you're not, how often are people sweating? It should be daily, and most of us don't sweat daily. Notice where you're breathing from. Is it just the top third of your lungs? Because a lot of us don't belly breathe. A lot of us are stressed, tight shoulders, going like this. And so that respiration is compromised. And so our foramunctories, our ways of detox, are compromised. Then you add in running late, microwaving something in plastic, getting a little gasoline on your hand. I know I have a nail polish on. This is actually horrible for you. But it's ubiquitous in our society, the exposure we have. So this plays a role in bone density. I showed you guys this study last time, just looking at air pollution and the increase in oxidative stress and inflammation, and that impacting bone loss, which is, you can't control your air. We can up our antioxidants, but it's something to be mindful of. Polycyclic aromatic hydrocarbons are found in lots of things, typically burned, but like gasoline is one of them, right, that we get exposed to. Tobacco is another one that unfortunately a lot of people get exposed to still. I don't know the status on vaping. I have to think it's probably not great for bone density. So these screw up our bone density as well, and there's been strong associations with exposure to these hydrocarbons and bone density issues. Heavy metals are probably one of the biggest ones to look at for risk for bone health. So again, these heavy metals are going to compete with calcium. They like to climb into spots like this. Our body's smart, and it like doesn't want mercury floating around in our body, so it's going to shunt it into places like bone or body fat so that it gets it out of our bloodstreams, because it doesn't want it there. And we get exposed to stuff. We have the ability to clear it. I don't know if I put that in or not. I didn't put the cool little slide on. The liver can deal with it and put it into your colon and get around, as long as you're having regular bowel movements, especially if you're sweating and moving and all those great things are happening. But, they did a sample, it was in 2009, can't be any better now, where they took people's body fat and they took a little piece of adipose tissue and they tested it and found over 120 chemicals in the body fat, because we're shunting this stuff away. And so weight loss resistance can be a sign of toxicity. Neurological signs can be a sign of toxicity. These can be important things to look at. One thing I should have put in here, if you want to jot down, ewg.org. Sunscreens have a ton of junk in them. And so you really want to, that's an easy win to reduce your toxic burden. And that could really translate into bone health. Sunscreens are very important for preventing cancer and sunburns, but as a pasty pale Lauren, but I would highly recommend getting a good quality sunscreen. So that ewg.org is the environmental working group. It's a non-for-profit that tests products and gives them a grade and helps you find a good sunscreen. And they also look at foods for pesticide exposure. So these can reduce your toxic burden. And the perfectionist in me doesn't love telling you guys that we're going to get some level of exposure. You're going to have to just work on reducing it. So if we can, holistic but realistic, if we can have some organic food, and if you can get a nicer sunscreen and not do your nails all the time, which I don't, and those type of things will reduce your exposure substantially. Cadmium is one of the biggest offenders to bone density. It is the best way to detox it is sweating. So that's probably why far infrared saunas are so cool. And it really wreaks havoc on bone density. So the other thing is, if someone's young and or if you have like a bone density where you're like, man, I am doing everything right and it just keeps tanking, we may want to look at heavy metal toxicity. There's a lot of myths around that, around heavy metal testing and heavy metal detox. Those foot baths, I don't know if anyone's ever seen them, where you go to a spa and you put your feet in this like bath and it turns brown or some color, looks really cool. I've never seen any really good research about it. That doesn't actually detox you. Some people will get their hair tested. I've seen someone get their stool tested. I don't know that those actually have any research behind them either. The best way to have it done, you can have it done in your blood. If that's high, that's a really big problem. That's like lead poisoning in a little kid, and you need to get that addressed urgently. But that can be a screening. And then if you were really concerned, you have some other symptoms of a heavy metal testing or heavy metal toxicity, you can do a urine test. And so what they'll do is they'll do a provoked urine. So they'll give you a little bit of an agent that'll like shake a little bit out of your body, and then they'll collect your urine, and then that'll give us an idea of what's going on in your body and if it's something we have to address. Reducing exposure, helping those four emunctories are like the biggest things. Again, there's associations with nutrient deficiencies with these two. So now that everyone's thoroughly grossed out by heavy metals, also I found some really interesting research that lead goes up with menopause, and or is associated with an earlier menopause. So early onset menopause and lead somehow have these connections. I'm sure there's like a lot of other pathways beyond bone density, but something to be mindful of. I know, from our knowledge in conventional medicine as well, like, lead toxicity is typically found in children who get exposure in old houses, and it can really impact their dental health as well as bone health. It's something that you address very promptly. So again, if we're seeing some issues with menopause super early, it might be something to look into, just checking your lead levels. If you think you've had exposure or a history of lead toxicity, is something else to look at as well. All right, so you guys have been with me for almost an hour now. This is where we get a little goofy with it because I had to keep you guys going. So there are these, you may have seen them in gyms. Sometimes chiropractors have them. I think, do PTs have them too? Those the Life Pros?
I've never seen one, but I have worked with a chiropractor who does exercise afterwards.
Yeah, so there's actually some good research on it. I mean, so again, bone density and preventing fractures by reducing risk of falling and creating a fracture, and especially in your femoral head and neck, is, if you're in the place where you're not as ambulatory as you want to be, shaking can actually wake up your bones a little bit. And this is a cute little study, so shake it off, because I have a 10-year-old, so that's in my world right now. And I figured I had to get goofy right now because we've been talking bone density for an hour. So there's a lot of these machines out there. You basically just stand on them and they vibrate, and they've been shown to help with a couple different things, but bone density was one of them in a meta-analysis, which is like looking at a bunch of studies really critically. So I thought that was kind of fun. Another thing is, last time I kind of touched on, there are risks of bone density issues with an increased risk of fractures with certain medications. And some of these are like that makes sense ones, like medications that reduce your calcium levels, like diuretics can happen with, or medications that, like steroids, we know reduce production of any kind of growth, so it can affect bone density, or things that reduce absorption, right? Like your proton pump inhibitors, your H2 blockers, stuff to help with acid reflux. Those are like that makes sense ones. But one that I thought was really interesting, and I think it's an incredibly important class of drugs, and saves probably as many lives as steroids. So there's a bunch of research on steroid ones, by the way, but we can fly past those, is SSRIs. So serotonin, incredibly important for mood. I think, especially post-COVID, depression has been an all-time high, isolation, and all the stress that we've been under have definitely increased anxiety and depression. And these medications do help our brains have more serotonin, which can help us kind of wrap our minds around things and get a handle on things. Working with a therapist, and sometimes these medications can be a life changer, truly, and lifesaver. But interesting enough, 2/3 or more of your serotonin is actually not in your brain, it's in your body. And there's a ton of studies, and I grabbed them all because I figured it was interesting, and I did a deep dive. So there's a lot of research here showing essentially the increased risk of fractures and decrease in bone density associated with serotonin, selective serotonin reuptake inhibitors, the SSRIs, like Prozac, Zoloft, those things. Stay on those medications. Just something to be mindful of, that you're a little more at risk for bone density issues if you're on this medication, which is a really common one that you wouldn't think be associated with bone density. So that's, again, so serotonin impacts is, primarily found a lot in the GI tract. It impacts a lot of different aspects of things, but it's going to downregulate, your absorption of of calcium and your production. So something to talk about with your doctor. And, I think that those medications, again, are very important. I'm not telling anyone to stop it, just something to put on your radar. Oh, and this is my Gigi. she has osteoporosis. She's going to be 91 in August, and takes her vitamin D and her vitamin K from her granddaughter and a bunch of other things. Those are my kids with her. So, I think, does she do everything that I said in this lecture? No, no. But I just wanted to say, like, this is a topic near and dear to my heart, and she's never had a fracture, and she's going to be 91. So I do think it's important to be proactive. You can have the diagnosis of osteopenia and for osteoporosis and have a really healthy, full life. I think it's more about being proactive and mindful and going like, okay, this is a pattern and this is a symptom. How do I make sure I address any underlying causes and be as mindful at like taking care of my body as possible? So thank you so much, guys.